And welcome into Getting Help from Uncle Sam. We're in the state of Alabama. It's Aunt Alabama. And today, if you've been watching television from now until the beginning of December, you'll see multiple commercials letting you know that it's Medicare re-enrollment time, when you can change or you can do a lot of different things, and everybody's got an offer. So to make it simple, we brought in the expert, Nick Nyberg, Alabama Department of Senior Services. Glad to have you back.
Good morning,
Is
Jack.
it just an annual thing? You come on for a couple of other things too, don't you?
I've come on and talked about all the different services our department
Absolutely.
offers, but for the most part we talk Medicare talk because it's a very important time of year.
That's right. And that's the area that you focus on too, isn't it?
That is correct.
At the Alabama Department. So it's starting here in September.
October.
October. That's the reason we have you on in September, is to give them news about when October starts. And it goes to the middle of December, right?
Correct. It starts October the 15th.
Okay.
It goes through December the 7th.
December the 7th.
And it is a very important time of year because Medicare can get confusing. So people need help navigating the different parts, the different coverages, what the costs are, things like that. And so we're definitely here to help with that.
So basically, I'm on Social Security. I get Social Security. And part of that is they take some of my money out to cover my Medicare benefits, right?
Right.
And that piece keeps going up all the time. Do my benefits go up along with the rising cost?
They do not.
They do not. Okay.
Unfortunately. Sometimes it depends on the plan. And that's
Okay.
exactly why our state health insurance program exists, is to run comparisons for Medicare recipients
Okay.
to ensure that they have the proper coverage at the right price, at the best price. And that's exactly why the program exists. And I always want to add that it's free counseling. It's unbiased counseling. The
Right.
counselors throughout the state do not work for an insurance plan. They're not trying to sell insurance to anyone. They're merely there to help that person navigate what's the best cost, how do we get signed up and move forward from there.
And you said a key word, counselors across the state.
Correct.
It means no matter where you live in the state of Alabama, there is a counselor that's within driving distance, pretty much.
That is correct. And let me say a very well-trained certified counselor, not just
Okay.
anyone that has been told here the Medicare plans, go do it. They go through extensive training. They're certified to do this. There's volunteers throughout the state as well as paid staff. That the paid staff oversee those volunteers. And no matter where you are in the state, they can contact or call 1-800-AGE-LINE, AGELINE. And that telephone call will go to their local agency and they will be able to receive that counseling. Now they can do it face-to-face if they want to do an office visit. They can do it via telephone.
The old-fashioned way.
Correct.
But my audience likes the old-fashioned way. I like to look that person in the face, see what they're telling me.
They get it all the time. And that's also why the counselors go out during the open enrollment time to do open enrollment events, so people can go to an event and sit down face-to-face and receive that free unbiased counseling.
So to do it, you're going to call, and then you show up at now you guys have got offices around the state. Would it be at one of your offices?
That's
Or
correct.
is it at senior centers?
Not at senior centers.
not
These
at-
offices, we actually contract with these offices.
Okay.
They're called Area Agencies on Aging. We call them AAAs.
Okay.
And there's 13 of them out throughout the state. They cover all 67 counties. And there's always a counselor available to either meet, phone call, or even those events, so they can get information on the events if they call that 1-800-AGE line, and they will be able to provide that counseling, exactly what they're tasked with doing.
And those 13 offices are open all throughout the year?
That is correct.
Okay, they're not just open during the Medicare, enrollment period. They're there to take care of any of the needs that you have as a senior.
That is correct. Because a lot of times during the year, of course, people are new to Medicare,
yes.
and that's not a during open enrollment. That's the
Right.
regular enrollment. And so our counselors are always in place throughout the year to provide counseling to help someone navigate and get that proper coverage.
So if you hit the magic time that now you're going to be eligible for the Medicare, and it's not during the open enrollment time, you're not really, you can still choose the one you want, right?
That is correct.
Okay.
Yeah. When someone's new to Medicare, they have a 7-month period to choose the correct drug coverage, supplement plan, Medicare Advantage plan. It gets confusing. That's why we have counselors to help them navigate that. And the 7 months would be 3 months prior to their 65th birth year,
Okay.
or their birth time at 24 months if they're on Social Security disability, the month of, and then 3 months after. So they have a long period of time to get everything situated.
And that's good to know.
Yes.
Because basically, when it happens, when you hit that age, when your primary insurance company says, we're no longer your guy, you're now on Medicare, you got to be prepared to choose and have one in place, especially as you're aging, because we are more prone to have, for lack of a better word, a medical problem.
Right.
That's going to need that help.
That's right. That's why the counseling is always available, ready to go. And I want to say something about that premium. You said that comes out of that when you're Social Security age.
Right.
There are certain people that have a certain income or lower that may be eligible for a extra help benefit.
Okay.
And our counselors are very well equipped to screen and to help someone apply for those benefits to help save out-of-pocket money.
Key point. Very good. Thank you as always. Anything else comes up, call me. We'll put you back in that chair.
You got it.
Just remember this, starting in October till the 7th of December is the period that you can make a change to your Medicare coverage that you've got. And remember this, it's very easy, 1-800-AGE-LINE, and you can get all the information you need. We'll be right back right after this.